thank Senator Sheikh Omar for the Vice Chairperson of Health Committee of this House for ably moving. She has been overworking. Madam Speaker, I remember the last time you exited the seat, we were in the same place, same setting, same actors, Madam Speaker. So it's very coincidental. I was just remembering. I want to thank Senator Sheikh Omar, the Vice Chairperson of the committee. I want to thank the Committee of Health for the good job that they have done. Madam Speaker, just to repeat what I had said yesterday, is that we need to continually encourage our committees, the Senate, to still engage. Let us go and do stock taking. Madam Speaker, I'm saying this because I'm aware next week we shall be breaking off for the devolution conference in Homa Bay, the county of endless potential, to stock review of devolution for the last from 2013. Madam Speaker, I often say, and I want to repeat, that the true test of devolution will only be measured to the success of health sector, because health touches each and every Kenyan, whether you come from Mombasa County, Migori, Nandi, Nairobi, Mandera, Elgeyo Marakwet County, Madam Speaker. It touches you even in Tana River. So the success story of devolution will be solely based majorly on the issue of health sector. I want to encourage the health committee to move around the counties. Let them give us the true facts. And Madam Speaker, I have noted specific trend that is common denominator in all counties or county working visits by most committees, especially on health, specifically on functionality, the infrastructure, the staffing or human resource, and the ICT or the use of technology in the health sector, and also the challenges that is almost common, Madam Speaker. Madam Speaker, on this working visit of Trans Nzoia, West Pokot, and Turkana counties, Madam Speaker, yesterday we had an issue of discussing Kwale, Mombasa, and Taita Taveta. Madam Speaker, on the issue of Trans Nzoia County, it's experienced similar. What I have noticed, Madam Speaker, on most of the counties is the issue of expiry of drugs, especially in our health facilities, both at the county referral hospitals to the county level. Even in Nandi, we have similar challenges of expired drugs. I don't know where the people who are in charge of health departments, Madam Speaker, are doing, and the KEMSA and other state actors to ensure that we don't supply expiry of drugs is a bigger challenge. And I don't know what evaluation and monitoring unit is doing to ensure they address the issue of expiry of drugs in our counties, Madam Speaker. Especially when you look at Kitale County Referral Hospital, I'm happy the stakeholders of County Assembly, the area senator was there, Madam Speaker, and the challenge, another challenge I saw, one is the expiry of drugs, and we must take a position. It cannot be that Kenyans come to get medication, but they go worse because of being administered with fake, expired drugs, Madam Speaker. I want to call upon the Ministry of Health, KEMSA, and other actors to ensure we go and ensure that the drugs are being dispensed in our hospitals and facilities are not expired. I visited Kapsabet County Referral Hospital in Kapsabet. You found expired drugs. I went to Maraba Sub-County Hospital, similar story. Madam Speaker, I've gone to Chepteruai, Nyayo Ward in Masab Sub-County, Madam Speaker. Even in Nandil Sub-County Hospital. Even when I visited Mosoriat Hospital, Sub-County Hospital, you get expired drugs that are being eaten. In fact, when I went to Mosoriat Sub-County Hospital, it was interesting because they had eaten it behind the kitchen so that no one can notice. Why don't they incinerate or dispose of the expired drugs? So what you see also in Kitale County Referral Hospital and most of the facilities in Trans Nzoia is the issue of expired drugs, which is common in all counties. There's also poor security measures, which, we had a story in Kapsabet County Referral Hospital where a child was lost, a newborn baby was being lost. And that matter is actively being investigated by the DCI Kapsabet, and I hope It shows that there is lack of security. You saw in KNH, one of our biggest Kenyatta National Hospitals, Madam Speaker, a patient was killed and was not the first, it was the second patient. And I'm happy CS Douala has indicated that North Kapsabet Kenyatta National Hospital should have a 24-hour surveillance courtesy of CCTVs. When you go to Trans Nzoia hospitals, West Pokot, and Turkana, there is lack of security, Madam Speaker, and therefore, the issue of CCTV surveillance must be encouraged so that we don't see what we see in Kenyatta National Hospital, where a patient was killed. And I hope the KMPTC will ensure, and I remember there was also another lady that lost a child out of medical negligence. I hope the necessary state actors can look. So the issue of surveillance systems within our hospitals must be improved. Madam Speaker, it is very unfortunate that we are also discussing the issue of ambulance. Limited ambulance, for example, in Trans Nzoia County, Madam Speaker, that they lack ambulance. But the governor of Trans Nzoia is busy oversighting national government, and he cannot even buy an ambulance. Madam Speaker, it's very unfortunate. I saw him questioning where did the money come that was given to Harambee Stars come from. If he cannot purchase an ambulance, he doesn't have a local standard to even discuss national issues, Madam Speaker. So it is very unfortunate that Trans Nzoia County is a going concern, Madam Speaker, on the issue of ambulance. And even the issue of CCTV, the issue of surveillance, Madam Speaker. Madam Speaker, so we must agree. Even the issue of theater at Kitale County Referral Hospital, it is in dilapidated condition. And the only thing that the governor has done is to run away by upgrading Kijana Wamalwa Hospital, instead of visiting Kitale County Referral Hospital, Madam Speaker, which is in a pathetic situation. Madam Speaker, you are aware, and I want to thank the great people of Trans Nzoia, and by extension the Mulembe Nation, because they are doing a good job. Madam Speaker, what better can Kitale County Referral Hospital have than a functional maternity hospital? Madam Speaker, the Mulembe Nation is giving birth at a good rate that I think the northern part of Kenya is also trying, but they are not at that part. Because maternity ward in Kitale, Madam Speaker, is doing very well. And therefore it needs to be improved. Because if you see an average of 650 deliveries annually, Madam Speaker, the maternity, and that is why, Madam Speaker, to be fair, I don't want to appear, people think that we are playing politics. But if you cannot fix maternity wing, maternity hospital, maternity, and the people have done a good job, men and women of this country, men of Trans Nzoia, are giving us good work. You know the reason China, Madam Speaker, and US are doing well is because of population. The market, you cannot sell when you don't have people, Madam Speaker. Yeah? And I don't know why the senator of Tharaka Kataya Mwenda is laughing. I think they should borrow lessons from men of Trans Nzoia and Mulembe Nation on how to execute some of these duties. So we challenge the governor of Trans Nzoia, instead of singing Tawe everywhere, he should fix maternity wing in Kitale County Referral Hospital and stop disturbing the party leader of DAP, Wamalwa, CS Eugene Wamalwa. On the issue of laboratory, there was another challenge. I think the issue of pharmacy we have mentioned, the issue of security, and even tied up to maternity is a pediatric wing. And it is important that your visitors on the gallery, most of them are still young, and I know they visit pediatrician. So we want when the children are given birth, under Article 53, child's best interest, they are taken to pediatric doctor, they receive good medical care, they grow into bouncing baby boys and baby girls. Although I had, Madam Speaker, as we go to the, from where I come, this is August, there is a lot of ceremonies around. I don't know whether Malinya will have the bullfighting or is it up to December. But there are so many ceremonies, especially weddings, pre-weddings, and we want them when consummation happens, Madam Speaker, they get a good pediatric wing, especially in Kitale County Referral Hospital. And Madam Speaker, as we go to ceremonies, I have never understood, maybe the caterers, people who do catering. Why would you put rice and watermelon? Madam Speaker, those people should be given notice as we go for ceremonies of August, Madam Speaker, because I don't understand why would somebody put rice and watermelon together. I think the people who do balancing, please, especially during this ceremony season, please avoid that. Finally, on the issue of Kitale, the issue of Trans Nzoia, I am to note, and I'm happy the chairperson of roads is here, is that we are doing very well in terms of share. I think 25 million Kenyans have registered. I can see there are still liabilities. I want to appeal that these liabilities of NHIF should be sorted out through FIF and ensure that share now that 25 million, Madam Speaker. When this issue of 25 million Kenyans have registered, it shows, Madam Speaker, out of 55 million Kenyans are Kenya National Bureau of Statistics of 2019, Madam Speaker, almost a half of Kenyans are now in SHA, which means all Kenyans have faith and confidence in working of SHA. Unlike the people who have been castigating this issue, I think Kenya, and I had an engagement with World Health Organization representatives, and they were telling me the issue of universal health coverage is being taken root from Kenya in Africa, Madam Speaker. So the fact that Kenyans are now registering in numbers to be part and process of SHA is a significant step in advance to universal health coverage. And I'm happy the government has started Malipo Pole Pole, that program, so that Kenyans don't have to pay the whole year, which is a significant step in access to medical care in this republic. So on this issue of NHIF liabilities, I hope and I'm happy that CS Aden Duale has stabilized the health sector and will ensure that all liabilities that within, even on the issue of KEMSA, the issue of KEMSA debt, Madam Speaker, we were told it is above 3 billion that is being owed by counties. I want to appeal that the Trans Nzoia County government pays KEMSA a debt of 106 million, just the way we saw Mombasa, even in Nandi and many others, Madam Speaker. Madam Speaker, and this on the issue of ambulances, we need to conclude quickly so that I can allow my colleagues to also contribute. Let me just make a few comments on West Pokot and Turkana County. Madam Speaker, on the issue of West Pokot, so the challenge in Kitale County Referral Hospital, health facilities in Kitale or in Trans Nzoia, they must be handled properly. And I want to challenge the executive, led by the governor, that the health sector in Kitale is deplorable, is dilapidated across Trans Nzoia, in all sub-counties, Madam Speaker, and ask the governor to go slow on national politics and focus majorly on what the people of Trans Nzoia elected him for, and ensure that he delivers, especially on the health sector, because that is where the cornerstone will be, and stop disturbing Eugene Wamalwa of DAP. On West Pokot, Madam Speaker, the county governor, I think the access to medical cover, I'm happy the Kenya West Pokot, there was a Kenya Medical Training College. There are 175 health operational hospitals. I think the issue here is human resource, which is common, and sufficient funding, existing oxygen plant. Madam Speaker, the governor of West Pokot, Governor Kachapin, must and should ensure that there is a functional oxygen plant for access to oxygen supplement with these facilities in West Pokot. Madam Speaker, on the issue of asbestos roofs, it has been banned in Kenya. I don't know, Madam Speaker, I don't know why they have not removed. Today need the Senate Health Committee to direct them. You know, Madam Speaker, some of these mundane issues that Governor of West Pokot should be handling should not be escalated to the Senate, even removing. And it has been banned, Madam Speaker, because they say it causes cancer. Therefore, the issue of West Pokot, we have Kapenguria County Referral Hospital. I think the issue there is expiry of drugs, demoralized work staff, where they are not even provided, apart from salary, they are not given extraneous or allowances. Madam Speaker, you remember, and I know you are guests on the gallery, some of them would want to grow to be doctors. They need to work in a clean, hygienic environment. And I remember as even the Union of Doctors and Nurses and Health Practitioners, PASU, they should ensure that, Madam Speaker, the work environment, there should be gloves. There should be hygienic, protective equipment, PEPs. And I think most of us knew these things, especially during COVID 2019. It is sad, in last year, early this year, I visited Kapsabet County Referral Hospital. And I was shocked, some of the health workers in Kapsabet County Referral Hospital was telling us when a patient comes, they have to send a patient to go and purchase gloves so that they can come and attend the patient. Apart from purchasing gloves, they have to purchase drugs. And even other liquids that normally are being given to the patients, Madam Speaker. And even they have to buy blankets. And you know those blankets that we use at home and what is being used in hospital, there is a reason that the hospital, Madam Speaker. So I was shocked that in Kapsabet County Referral Hospital, you go and buy gloves and then you come. And I agree with the doctors in Nandi and health practitioners and nurses, because how can you risk your life to get and even gloves and masks? How can you risk your life to get infected? Yet, Madam Speaker, you are aware when you are infected, you remember the story of Dr. Chacha in Kenyatta National Hospital, where when he became sick, he could not even get medical attention in Kenyatta National Hospital. Yet, Madam Speaker, it was. So it is the similar situation, Madam Speaker, that we see in Kapsabet County Referral Hospital. We are seeing it in Kapenguria. Madam Speaker, I want to call out the West Pokot governor and executive. How can they fail to provide privacy? The lack of curtains and bed screens. Madam Speaker, I thought curtains are being sold out in Isilia. Do they need a Senate to direct them to give privacy to patients, Madam Speaker? This is very unfortunate. These curtains and screens are things that the county should do. So if the governor and the county executive of West Pokot can not only give privacy to patients by purchase of curtains, it is very unfortunate. Madam Speaker, on the issue of maternity, I'm happy to note that the great people of West Pokot are doing a good job in terms of birth rate, but unfortunately, we need to ensure that both antenatal and postnatal care is given to our mothers and especially to children, including pediatrician cover. On the issue of pharmacy, and I'm happy the chair of health is in this committee, the issue of expired drugs, I think the committee should pronounce itself. We don't need, it should be a criminal offense to dispense an expired drug to any Kenyan. I think that one we should agree. Whether at referral hospitals or even at dispensaries that are 197 in West Pokot. Madam Speaker, finally on Turkana County, they visited Kangangetei Primary Health Care Camp. And on this, finally, Madam Speaker, I was disappointed because the issue of cesarean section, CS, especially to our mothers who are giving birth, Madam Speaker, I am a believer that no Kenyan mother or woman should lose their lives for giving birth, for giving life, Madam Speaker. It is very unfortunate. Even in Nandi, we are losing most of our women and mothers courtesy of giving birth because of delay CSS, because of delay access to be given assistance to deliver, Madam Speaker. The issue of Kangate Primary Health Camp should imagine if a mother wants to give birth in Turkana County in Kangate hospital or dispensary or primary health care, they have to travel 35 kilometers to Kamatoso Referral Hospital for CS and ultrasound. In this day and age, where the recommended, I think the recommendation under the World Health Organization, we should have a dispensary around 4 kilometers a radius. But I'm saying it is very unfortunate that we have to, we might lose our mothers by giving life because of negligence. But I'm saying another factor that I've noted is on the issue of medical negligence. We have lost lives, and I hope, and I want to request the Chair of Health and members of Health Committee, they should give us a breakdown on how many Kenyans have been lost through medical negligence, Madam Speaker. Number two, how many cases are being handled by Kenya Medical and Practitioners Dentist Council, KMPTC, Madam Speaker, so that I want to thank President William Ruto, because in all these visits, one of the biggest support has been community health promoters. And I think the only challenge we have with CHVs in the payment of their stipend. I want to ask the Ministry of Health and our county governments through Council of Governors to fast track the issue of stipends to community health promoters who are working, Madam Speaker, in our homes. And I'm happy when you look at the report, millions of homes of Kenyans have been visited by CHBs and CHBs, Madam Speaker, that have ensured that at least you receive treatment. Madam Speaker, there are Kenyans who are suffering from palliative care, home care, and I think with the advent of community health promoters, this was the genius masterstroke by His Excellency President William Ruto's government to ensure access to medical care is not a privilege. And I want to support the motion that has been sponsored by nominated Senator Sabina Chege, that all of us should be treated in our public health hospitals. Madam Speaker, the fact that a number of us are being treated in high-end hospitals, which are private facilities, undermines the oversight. You can imagine if Senator Faki is being treated today at Coast County Referral Hospital. The confidence and the faith and even the seriousness. Oh, okay, thank you. He normally goes there. That confidence of Senator Faki being treated at Coast General Hospital is a confidence that all public servants, from all of us, I dream of the day that a number of us will go to Kenyatta National Hospital. Although I've used it once or twice, Kenyatta National Hospital, a number of us will use public facilities. But I'm saying that the millions and millions we pay in medical insurance cover, we should give it to public health facilities so that they can be able to grow, so that they can be able to give the medical care, Madam Speaker. I am informed by an unnamed governor or a number of senior officials are traveling to seek further medical care in India, in US. Madam Speaker, we are demoralizing. Our young men and women who are health practitioners, they want to be treated here, Madam Speaker. Madam Speaker, with those many remarks, I beg to second this motion, and I thank you.
Honourable Senators, I propose the question that the Senate adopts the report of the Standing Committee on Health on the inspection tour of health facilities in West Pokot, Trans Nzoia, and Turkana counties